Welcome to CSU's Bloodborne Pathogen Training, presented by your CSU Infection Control Team. Objectives listed here. Know your exposure control plan, where to find it. Define bloodborne pathogen exposure and risks. What is hepatitis B, hepatitis C, and HIV? How to protect yourself. Standard precautions, PPE, sharp safety, regulated medical waste, cleaning blood spills, what to do if you have an exposure, and how to submit an ECOM claims. The exposure control plan is an OSHA bloodborne pathogen requirement. Employers must ensure a copy of the plan is accessible to employees. Our plan can be found on Policy Stat. Bloodborne pathogens are microorganisms that can be found in human blood that cause diseases, including Hep B, Hep C, and HIV. Healthcare personnel exposed to bloodborne pathogens are at risk for serious or life-threatening illnesses. Hep B and HIV are spread through direct contact with certain body fluids. Listed here, Hep C is typically spread through direct contact. The vast majority, thankfully, of occupational exposures do not result in infection. Exposures to blood and other body fluids occur across a wide variety of occupations. Healthcare personnel, emergency response members, public safety, security officers can be exposed to needle sticks, sharps, mucous membrane splashes, and skin exposures, and human bites. Hep B is a vaccine-preventable liver disease that can cause mild illness or lead to more serious lifelong illness. Hep B is spread when blood, semen, or other body fluid infected with the virus enters the body of a person who is not infected. It's also transmitted mother to baby during pregnancy or delivery. Babies who are infected who have not been immunized after birth have a 90% chance of developing a lifelong chronic infection. Hep B symptoms. Acute Hep B infection is a short-term illness that can lead to fever, fatigue, loss of appetite, nausea, vomiting, jaundice, pain in muscles, joints, and stomach. Chronic infection is long-term. It occurs when the Hep B virus remains in the body, can lead to liver damage and cirrhosis. Chronically infected people can spread Hep B to others even if they do not feel or look sick. Hep B transmission risk upon exposure to bloodborne pathogens depends on the infectivity of the source and the severity of the exposure, how much blood was present, how deep a puncture was, etc. As you can see, the percentage of risk with a needle stick and percutaneous injury if the patient is positive. The risk of infection is 23 to 37% if the patient has active infection, meaning the source patient, and the risk of developing clinical hepatitis is 1 to 6%. Best way to prevent infection with Hep B is to be immunized. Employers are required to offer all healthcare workers Hep B vaccine at no cost. Employees may sign a declination if they do not wish to receive the vaccine. Hep B is treatable with antivirals, but is not curable. Hep C is a viral infection that causes liver inflammation, sometimes leading to serious liver damage. It occurs primarily through exposure to infected blood. Healthcare personnel exposed to infected blood through needle stick injuries may acquire Hep C infection. Symptoms of Hep C virus. Long-term infection is known as chronic hepatitis C and is usually a silent infection until the virus damages the liver enough to cause signs and symptoms of the disease, which may include what you see listed here. Hep C, transmission risk after a bloodborne pathogen exposure. The risk of infection following a needle stick injury from a Hep C source is approximately 1.8%, although this risk is not as well defined as it is for Hep B and HIV. There's no vaccine for Hep C and no effective post-exposure prophylaxis. The only way to prevent Hep C is to avoid blood and body fluid exposures. Cure is possible for Hep C with a treatment plan that includes antivirals, medical evaluation, testing. The antivirals are highly effective at clearing the infection, and the therapy lasts for 8 to 12 weeks. Although there's no vaccine against Hep A and Hep B will further prevent damage to the liver from Hep C. In some cases, the liver can sustain such damage that a transplant is needed. Unfortunately, a liver transplant alone does not cure hepatitis C. HIV. HIV is a sexually transmitted infection spread by contact with infected blood or from mother to child during pregnancy, childbirth, or breastfeeding. Without medication, it may take years before it weakens your immune system to the point where you have AIDS. AIDS is a chronic, potentially life-threatening condition caused by HIV. By damaging your immune system, it interferes with your body's ability to fight infection and disease. Symptoms of HIV. Some people infected by HIV can develop flu-like illness as early as 2 to 4 weeks after the virus enters the body. This is primary acute HIV infection. Symptoms are listed as follows: fever, headache, muscle aches, joint pain, and so on. These symptoms can be so mild that you might not even notice them. However, the amount of the virus in your bloodstream, called the viral load, can be quite high at this time. As a result, the infection spreads more easily during primary infection than in the latent stage. HIV transmission risk with a bloodborne pathogen exposure. The risk following a needle stick injury from a patient with HIV is listed here if no post-exposure prophylaxis is given. Post-exposure prophylaxis, also known as PEP meds, involve having the healthcare worker take anti-HIV medicine within 72 hours after a high-risk exposure. This reduces the risk of infection by about 75%. Pre-exposure prophylaxis medication called PrEP is available for prevention of HIV in high-risk adults and adolescents. Post-exposure prophylaxis after non-occupational or occupational exposure is available, and antiretroviral therapy, or ART, for HIV treatment and viral suppression to prevent sexual transmission is available. As you see on the slide, people with HIV who take HIV medicine as prescribed and get and keep an undetectable viral load will not transmit HIV to their sexual partners. Prevention measures. Hierarchy of controls. Engineering controls are items manufactured to prevent or eliminate risk, such as retractable safety needles or other engineered safety devices. Work practice controls are administrative controls that change the way you work. Use processes such as prohibiting recapping, warning signs, and training are also examples. PPE protects the worker, and it's tailored to the risk. Standard precautions are the minimum infection prevention practices that apply to all patient care, regardless of suspected or confirmed infection status of the patient in any healthcare setting. Per CDC guidelines, this consists of hand hygiene, PPE, respiratory hygiene and cough etiquette, safe injection practices and sharp safety, cleaning, disinfection, sterilization, and patient placement. Hand hygiene. Before and after all patient contact, wash for at least 15 seconds the scrubbing part with soap and water. Hand sanitizer before and after patient contact, after glove use, after contact with surfaces or equipment in patient areas. We follow the CDC guidelines for hand hygiene. PPE includes nitrile gloves, avoid latex to avoid getting sensitivities, mask or face shield and goggles, hair and shoe covers, fluid-resistant gowns, N95 respirators, long sleeve cuff jackets, and it's important to know the donning and doffing order for PPE. Respiratory hygiene, practice covering your cough and coughing in the bend of your arm if you don't have a tissue available. Safe injection practices and sharp safety includes using a safe zone for passing, like during procedures, avoiding hand-to-hand transfer, using engineered sharps injury prevention devices like needle recappers and scalpel blade removers. Cleaning, disinfection, and sterilization. Cleaning is a two-step process where you wipe, discard, and wipe, and the disinfecting is spray, wipe, and spray, especially if there's the presence of organic soil or if the IFUs specify to use the product this way. So there are some cleaners that are one step, and that will be specified on the label. The product must stay wet for the required time specified on the label. Cleaning a blood spill. Assemble the needed supplies listed here. Don your gloves. Ensure there are no sharps. Use disposable towels to soak up as much of the blood as possible. Wipe the area with water and detergent until visibly clean, and then you disinfect the area with the EPA-registered tuberculocidal disinfectant, working from outside to in, following the instructions. Dispose of the items in biohazard or sharps, and perform hand hygiene. Regulated medical waste. All these words mean the same for regulated medical waste, infectious waste, biohazard, sharps, red bag. It's not the same as other types of hazardous waste. There is a definition, and liquid or semi-liquid blood or other potentially infectious materials, contaminated items that will release blood or other potentially infectious materials in a liquid or semi-liquid state if squeezed, items that are caked with dried blood or other material that may release when they're handled or shaken, contaminated sharps, pathological and micro waste containing blood or other potentially infectious waste. Bags and containers must be sealed prior to transport. All biohazardous waste must be labeled as such. Do not overfill bags or sharps containers, and they should not be accessible to the public. Regulated medical waste. Here are examples. Gauze saturated with blood, a suction canister full of blood or other body secretions. And as a side note, never throw red bags or biohazard bags in the regular trash, even if they are unused and clean. These items listed or illustrated on this slide do not have to go in a red bag or sharps. A dirty diaper, unless it has bloody diarrhea, bloody dressings that are not supersaturated, vaginal speculums, catheter tips that don't have the needle has been removed, Band-Aids with spotting of blood from small wounds. IV tubing can go in the regular trash as well if it's not bloody or filled with a hazardous pharmaceutical medication. Sharps and needle stick injury. Definition of a sharp: objects or instruments necessary for the exercise of specific healthcare activities which are able to cut, prick, cause injury, and/or infection. How can you protect yourself? Avoid the use of needles where safe and effective engineered alternatives are available. In other words, stay away from non-safety needles. Give input for helping to select and evaluate devices. Use devices provided by your employer that are safety engineered and follow the IFUs. Avoid recapping. Plan for safe handling and disposal of needles before using them. Make sure you have a point of use sharps container, for example. Always know and follow the device manufacturer instructions for use. Here's one illustrated for a certain type of commonly used safety needle and syringe. Most sharp injuries occur when disposing of needles, giving injections, drawing blood, recapping, or handling trash and dirty linens, and there are sharps that were not disposed of correctly. Promptly dispose of needles, use needles in an appropriate container, report all needle sticks and sharps-related injuries promptly to ensure you receive appropriate follow-up care. Tell your employer about any hazards you observe. Participate in training. Get vaccinated. So what do you do when you actually injure yourself? Act fast. It's an acronym for flushing the site, alert your supervisor or the tour coordinator. Make sure an I-STAR submission is in there too. Go straight to the emergency department. It's usually Pod B, urgent care, that will see you. Receive treatment and counseling. All this should happen within 1 hour. Bring the completed form to Employee Health and they will give you a copy once they've logged in your injury and explained your follow-up. On the job injuries, who's responsible for what? The employee. Notify your supervisor, receive treatment or first aid, work with your supervisor for an I-STAR, and then if you need to file any e-comp related forms. Here's the claims process. This was provided by HR, and once your supervisor helps you through the process, it will proceed through as needed depending on your injury. If more medical treatment is needed, obtain a Form CA-16 that must be obtained from your supervisor. You do not have to receive care in this facility for this. Make sure the form is filled out no matter where you receive the care and give the completed form to your supervisor. Give any completed report to Employee Health to go into your Employee Health record. Your record is confidential, by the way. It's a hard copy blue folder, and that information is not released to anyone else. The provider completes the paperwork and returns it to the employee. The supervisor collects it, uploads to eComp, and assists the employee. Here is an illustration straight from our policy that has the evaluation form after a exposure injury. On the right-hand side, you see the provider's written opinion, and OSHA law requires a copy of this be given to the employee after the injury. When you go to Employee Health, as stated, bring the report from the provider that the provider has filled out. You will be given a copy. Employee Health will notify you for follow-up care and testing and give you any applicable results. And you can see that you have 3 years from the date of injury to report eComp submission. In general, Employee Health or your initial provider will order testing, and Employee Health will do follow-up testing in 6 weeks, 4 months, and 6 months, just depending on what your immune status and what the exposure risk was. And we will reach out to you. The infection control chair or designated physician will provide guidance as needed. The source individual should always be tested if known. If not known, then the provider may have to assume the source is positive. But this will be reviewed with you during your evaluation between you and the provider. You may decline any recommended testing or vaccination. You should receive counseling and an opportunity to ask questions and have your questions answered regarding risk and options for treatment and testing. Any additional questions that arise after your initial evaluation and counseling can be discussed with your personal provider or brought up to employee health staff who can help you navigate care. For more information, you can go to the CDC, you can look at the CSU Bloodborne Pathogen Exposure Control Plan, your supervisor, HR, employee health, or infection control. You can also contact HR for any e-comp claims process questions. This is just a screenshot of the e-comp website. Your supervisor can help you with that. This is a list of the forms mentioned previously. Your supervisor and HR will help you with that. This will depend on whether or not you are a federal employee or a contractor. Contractors should always consult with their contracting agent. This gives you an idea how long it takes for various steps in the e-comp claim. And again, what you will need to have ready: register for an account, know your organization, your supervisor's information, details for the injury, have documentation available, a case number for an e-comp submitted claim, and then the forms for submission. Again, HR can help you with all this. And here's some more information, just reiterating that HR will help you with this process. And this is the chain of events and the timeline that you can expect. The civilian payroll tech gets notified. Your supervisor will receive emails to review the claim and completeness. There will be an agency reviewer who is an HR assistant. Your injury will be covered, your date of injury will be covered as excused absence. And there are steps to take with your supervisor for if you are incapacitated. And that is the end of this slideshow. Thank you.